I have seen thousands of elderly patients come to the clinic worried about symptoms such as chest tightness, shortness of breath, or sudden fatigue. And the cause is often not simply diet or stress. It's a medication they've been taking for years, sometimes even prescribed to help another condition. What many older adults don't realize is that some common medications, taken daily by millions of people over 60, can silently damage the heart muscle, causing high blood pressure or irregular heartbeats. These medications may not show immediate side effects. However, over time, they can impair heart function and negatively impact life expectancy. In today's video, I'm going to name 7 drugs that can seriously damage your cardiovascular system, something many people don't realize. It is not a matter of fear, but of understanding and awareness. If you or a loved one over 60 is taking medication to relieve pain, aid sleep, regulate blood sugar, or stabilize mood, don't miss this video. Pill number 1 is the most harmful and most commonly used IV. I do not recommend that you stop any medication without guidance from a medical professional, but you have the right to know the truth. So let's start with the 7th pill. Pill number 7 is a class of drugs called non-steroidal anti-inflammatory drugs, or NSAs, which includes popular ones like ibuprofen and naproxen. These drugs are often used to treat arthritis, joint pain, or back pain, common health problems in older adults. Many people over 60 take these medications every day without realizing how dangerous they can be to the heart. NSAIDs can increase blood pressure and cause fluid retention. This makes your heart work harder. In people with weak or aging hearts, this increased pressure can lead to heart failure or irregular heartbeats. Over time, NSAIDs can damage blood vessels and impair kidney function, putting extra strain on your cardiovascular system. If you have high blood pressure or are taking heart medications, these medications can secretly negatively affect the effectiveness of your treatment. You may not see results immediately, but your heart is still under constant pressure. That is why elderly patients need to be extremely careful when using non-prescription pain relievers. There are safer pain relief options that do not increase the risk to the heart. Always talk to your doctor before continuing to use NSAIDs for longer than a few days. Pain relief shouldn't come at the expense of your heart health. Let's move on to the 6th drug, which gets even more dangerous over time. The 6th pill is certain diabetes medications in the thiazolidinediones group. If you're managing type 2 diabetes, there's a group of drugs called thiazolidinediones, which includes drugs like pioglitazone. These drugs are designed to lower blood sugar levels, but they can also silently damage your heart. These medications can cause fluid retention, swelling in the legs, and even lead to congestive heart failure, especially in people over 60 years of age. While the goal is to control blood sugar, the potential risks to your cardiovascular system are serious. Many older people with diabetes are already at high risk for heart disease. When you add a drug that increases stress on the heart by causing the body to retain more fluid, it makes for a dangerous combination. What's even more worrying is that these drugs can mask early signs of heart failure, such as feeling tired or short of breath. Some doctors may still prescribe these medications because they are effective in controlling blood sugar levels. Control is one thing, but if you have a history of heart disease or even just mild swelling, this drug can silently accelerate the damage. Always ask your doctor if there are safer alternatives. Blood sugar control is important, but not at the cost of weakening your heart. Now let's move on to the number 5 drug that millions of seniors still take every night to help them sleep. Many older adults have difficulty sleeping and rely on sedative hypnotics such as zolpidem or older medications such as diazepam. These drugs promise to help you sleep better, but they often come with serious consequences for your heart health. Sedatives reduce the activity of the entire nervous system, including heart rate and blood pressure. While it may sound beneficial, this actually reduces your body's ability to respond to stress or oxygen needs while you sleep. Over time, these medications can cause sleep apnea or worsen existing apnea, a condition that causes you to stop breathing for short periods at night. This puts a lot of pressure on the heart and can cause dangerous heart rhythm disturbances. Additionally, these drugs can disrupt the effects of essential heart medications like beta blockers, making treatment less effective. As people age, their risk of falling, confusion, and breathing problems increases, especially for those taking multiple medications. Although insomnia needs to be treated, long-term abuse of sedatives can negatively affect brain and cardiovascular health. There are many natural and safer methods to help you improve your sleep without harming your health. Talk to your healthcare provider before continuing to use any sleep medication on a regular basis. Now we're talking about the fourth pill, a popular mood stabilizer that can slowly damage your heart. You may not know that tricyclic antidepressants have many potential side effects. This older drug is often prescribed to treat depression, anxiety, or chronic pain. Drugs such as amitriptyline or nortriptyline were once widely used, but they carry a risk of cardiovascular effects, especially in people over 60. These drugs carry the risk of causing a number of cardiovascular disorders, such as irregular heartbeat, fluctuating blood pressure, and even heart block, a dangerous condition. Over time, these drugs can disrupt the electrical signals that regulate your heartbeat. For that reason, these drugs are especially dangerous for older people who already have arrhythmias or have a slow heart rate. Additionally, these medications increase the risk of dizziness and falls, leading to injury and potential complications. Even at low doses, if used long-term and without careful monitoring, these drugs can still cause harm. There are now new antidepressants that are much safer for the hearts and brains of older adults. Unfortunately, there are still doctors who prescribe these older medications out of habit or personal concern. If you are taking a tricyclic antidepressant and experience fatigue, dizziness, or a fluttering sensation in your heart, pay attention and do not ignore it. Ask your doctor if there is a safer alternative for you. Now we come to pill number 3, which millions of older adults take every day for a common ailment, but which also carries potential risks. Before you move on to pill number 3, here's some urgent information you need to know. If you are over 60 and taking medication or simply want to protect your heart, see your doctor for advice. Doctors will advise seniors to monitor symptoms, take medication, and detect warning signs early before it's too late. The decongestant pseudoephedrine is third on the pill list. Decongestants such as pseudoephedrine and phenylephrine are commonly found in many cold and allergy products. These medications are often used by older adults to relieve nasal congestion or relieve sinus pressure, especially on days when the weather changes. However, these drugs pose a major risk to your heart health. These medications work by constricting blood vessels, which helps reduce swelling in the nasal passages. However, they also cause blood vessels throughout your body to narrow. Even the blood vessels that supply blood to the heart are affected, increasing blood pressure and making your heart work harder. For older adults, this pressure can be very dangerous, especially if you already have high blood pressure or heart disease. These pills can also cause you to experience irregular heartbeat or feelings of nervousness. You may feel restless, anxious, or even dizzy after taking these pills. It's your heart's way of warning you that something is wrong. Many people think these drugs are safe because they can be bought without a prescription, but age changes the way your body reacts, and what was once considered harmless in your 40s can now pose a major cardiovascular risk. Always read labels carefully and consult your doctor before using decongestants. Next up is the second choice drug, which is commonly used by older adults to control chronic acid reflux, but little is known about its potential effects on the heart. PPI proton pump inhibitor dual pill. Proton pump inhibitors, or PPIs, include drugs such as omeprazole or pantoprazole, which are used to treat acid reflux and heartburn. Millions of seniors take these pills every day in the belief that they are completely safe, but recent studies show that long-term use may increase the risk of heart problems. PPIs reduce stomach acid, which helps control reflux, but this acid also plays an essential role in the absorption of nutrients like magnesium. PPIs reduce stomach acid, which helps control reflux, but this acid also plays an essential role in the absorption of nutrients like magnesium. Long-term PPI use may also affect gut microbiota and promote inflammation, which is strongly linked to the risk of cardiovascular disease. If you have been using a PPI for more than a few weeks, especially if you're over 60, it is time to reconsider your use of this medication. These medications should only be used for short-term pain relief unless absolutely necessary. If you have chronic heartburn, work with your doctor to find the real cause instead of just masking the symptom. Long-term heart health should always come first. It's time we uncover the number one pill, both the most popular and the most dangerous, that is quietly eroding the cardiovascular health of older adults worldwide. Pill number 1, calcium channel blockers. Calcium channel blockers are medications commonly prescribed to treat high blood pressure, angina, or heart rhythm disorders. But there are medications, especially older ones like verapamil and diltiazem, that can pose potential health risks to older adults. Although these pills are effective at dilating blood vessels, they can also slow the heart rate too much. In the elderly, heart function may have weakened, which can easily lead to dangerously slow heart rate, causing dizziness or even fainting. Long-term use may result in swelling in the legs, feeling short of breath, and changes in heart rhythm. Some calcium channel blockers may interact with other common medications in older adults, increasing the risk of complications. Most worryingly, many older adults take these drugs without close supervision, making side effects easily attributed to age rather than the drug. Fatigue, swelling, or slow heart rate while taking these medications may be warning signs you should not ignore. You should not stop taking heart medication without your doctor's advice, but be proactive in asking about safer alternatives for your health. This pill is very powerful, but needs to be closely monitored. Now it's time to wrap up everything we've shared today with one final message. If you're over 60 and taking any of the medications we've talked about today, I don't recommend stopping them on your own. Instead, talk to your doctor. These pills are designed to be beneficial, but when used long-term or without close supervision, they can slowly harm your heart. I've seen too many elderly people hospitalized not because of illness, but because of side effects of medication. The goal is not fear but prevention. With full awareness and the right support, you can absolutely protect your heart, live healthier, and feel better every day. Always be vigilant and never be afraid to ask questions about the pills you are taking. Your heart is too important to ignore. If you found this video helpful, please share with your loved ones and subscribe for more life-saving tips specifically for seniors like you. Take care and stay strong.